before I share my idea with you, I want to share a little bit about our company to sort of provide the foundation and the context for the idea that we're going to talk about today. For those of you who don't know Allscripts is one of the largest healthcare information and software providers in the United States. We work with 180,000 physicians, so approximately 1 out of every 3 physicians in our country uses one of our solutions. We work with 1,500, hospitals. So 1 out of every 3 hospitals, non-federal owned hospitals, are using an Allscripts solution. We work with 10,000 post-acute care facilities. So post-acute care facilities would be skilled nursing homes, rehab centers, home care agencies. With our home care product, we have an electronic healthcare record where we have 27,000 clinicians every day in patients' homes working to help manage the care and the condition of the patients we serve. To give you a little breadth of our portfolio, and I'm not going to go into this in detail, but to share the context of what we do with our customers, for pretty much most of the providers across the healthcare continuum, we're their core electronic health record provider. So with physicians, we're providing EHRs, which is the fastest growing segment of our market, somewhat helped by the stimulus program set up by the government. Within a new acquisition we had with Eclipsys, we now have an electronic health record in the hospital, as well as niche applications within the hospital. So our care management product, our performance management products within the hospital. And then for post-acute care facilities, those 10,000 post-acute care providers are receiving electronic referrals from the hospital, so improving that transition of care, at least as the patient moves from an acute care setting to a post-acute care setting. And then we've begun to set up community solutions to begin to tie those things together. And as healthcare reform emerges and the focus and the risk gets pushed down to the provider, and their focus gets more centralized to connect a community, improve care coordination of a community, that's where we come in. So we think we have a very unique opportunity to change the healthcare landscape to help accelerate and improve healthcare reform, to begin to help our clients and partner with our clients to reduce costs, to improve healthcare quality and improve healthcare care coordination. And that's really what I wanted to talk to you about today, and the idea I wanted to share with you today. So this is a definition of care coordination provided by CMS, or the Agency for Healthcare Research and Quality. And it's the deliberate organization of patient care activities between 2 or more participants, including the patient and possibly the patient's family, involved in a patient's care to facilitate the appropriate delivery of healthcare services. So for those of you who have unfortunately used our healthcare system, or maybe had a family member who was in and out of a hospital, you probably recognize when a patient leaves a hospital and shows back up at the physician's office, many times your primary care physician doesn't even know you went to the hospital. They don't know what you went to the emergency room. They don't know what your discharge medications were. They don't know what your discharge plan was, your discharge instructions, etc. A lot of times the patient doesn't even follow back up with the primary care physician, so it could be weeks or months before that information gets communicated back to the other members of the care team working with that patient. This is a real issue, obviously, with our healthcare delivery system, and it's an issue that's being focused on with all of the healthcare reform packages that are now being pushed down by the government. This idea of improving care coordination, reducing unnecessary readmissions, unnecessary complications, there's a real opportunity to improve the way we deliver healthcare and really bend the healthcare cost curve. If we look at how we spend costs in the US, and I don't think this is a new news to anyone or a surprise to anyone, but the sickest 5% of Medicare beneficiaries consume over 40% of the healthcare costs in our country, and the sickest 25% consume over 80% of the healthcare costs in our country. So a very small few of patients who have multiple chronic conditions, who have socioeconomic issues, who might have family issues, are really consuming the majority of our healthcare dollars because there's not an aggressive way to manage those patients the way we deliver healthcare today. And really, that's what I wanted to talk to you about, and the idea that our company is going after, given our unique footprint in the industry. Again, we're working with all providers across the healthcare continuum, and one of the new roles that's emerging as some of these healthcare reform initiatives get started is the role of something called a health navigator or a care coordinator. And that person is responsible for helping to manage the patient and the patient family as they move from care setting to care setting across the healthcare continuum. We think we have a unique opportunity to help participate in that process, and we're beginning to build an online web-based system using our care management product that we have today as a foundation to help support those new health navigators. So as we think about the process of managing the sickest of the sick, first we have to identify them. So there's some type of risk stratification and risk profiling. There's many tools out there today in the industry that do that. So it's identifying those patients based on the information we have today, presenting those patients to the care coordinator and to the providers. So they identify this patient is high risk for readmission or high risk for consuming a majority of healthcare dollars as they move across the continuum of care. The care coordinator that will then use this tool to basically do some of the assessments with the patient and the family, develop the plan of care, and begin to push down that plan of care to the members of the care team using our footprint and the products that we have within Allscripts. So as you think about that, one of the real issues around that is actually identifying who is actually a member of the care team. And it sounds silly, but a lot of times we don't know as a healthcare provider when they show up in the hospital who your primary care physician is, what other specialists you might be working with, who's your primary home care agency you might be working with. So identifying those members of the care team, especially for these high-risk patients that tend to utilize a large share of healthcare services across the continuum. So setting up and identifying that care team, creating a tool within a patient-centered care plan where the care team can collaborate among each other and begin to work with the patient and the family to more efficiently utilize the way the patient moves through the healthcare delivery system and work more aggressively to manage the patient's condition with the patient and their family. So as you think about some of the activities that the care coordinator will go through, a lot of times it's phone calls or following up with the patient at home. We're thinking more about what about scheduling monthly or weekly calls using an online collaboration tool where the patient will at home begin to communicate with members of the care team, communicate with the care coordinator, see information related to the patient's record, relevant information related to the patient's record during that process, see the plan of care and the next steps and responsibilities that are involved with the patient and the family, as well as beginning to push down those tasks and responsibilities to the members of the care team, the targeted members of the care team that are treating that patient, and pushing them down into their native application, which happens to be Allscripts applications for electronic health records. We're also thinking about this in an open context. So it's not just Allscripts applications that might be used within a community. It's going to be some of our competitive solutions that are going to be used by physicians and hospitals as well. So our vision is really an open platform for those other systems to connect to this type of online collaboration tool to, again, improve the way healthcare is delivered, improve the efficiency, and the overall satisfaction for the patient and the family as they use the healthcare delivery system. So.